Start, Pragya.
Okay. Good evening. Welcome to our channel, Nitish Mehra and Law Associates. My name is Pragya. Today, I will be talking about the COVID-19 vaccination policy, states opting for global tenders and lack of vaccines in India, looking at foreign for mass production. So, the worldwide endeavor to create a safe and effective COVID-19 vaccine is bearing fruit. More than a dozen vaccines now have been authorized around the globe. Many more remain in development. Recently, India has developed the COVID-19 vaccines developed by AstraZeneca Covishield and Bharat Biotech Covaxin. Several more vaccines will be likely available in 2021. Although India would not need to vaccinate its entire population, it will need to vaccinate at least 30 to 40% of the population to achieve full herd immunity. Given that most vaccines require a booster dose, about 1 billion doses of COVID-19 vaccines will be necessary even on a small scale. Other factors such as allocation, distribution, financing, communication, and so on will obstruct the COVID-19 campaign. As a result, India will need to implement a strong vaccine development and distribution policy. Major challenges which are faced during this time are the allocation. Most nations will vaccinate healthcare workers first. They treat those who are infected with COVID-19 and vaccinate the remaining population. After that, it seems logical to prioritize the elderly who have a higher infection fatality rate. However, the premature death costs a young person of more than an older adult. This is more significant concern for India as 80% of its population is below 50 years. Distribution. Moving vaccines from companies to warehouses will be relatively easy, but moving it from warehouses to distributors to end users will be tricky, given the difficulties with cold chains and storage facilities. Financing. In the United States and the United Kingdom and Europe, vaccines are likely to be entirely free and administered publicly. However, given the tight fiscal situation, the Indian government faces the dilemma of whether to finance vaccines publicly or privately. Human resource. Administrating 30 to 40 million immunizations under regular vaccination drive a year is very difficult from vaccinating 600 million people in a year. Sourcing the trained human resources necessary to deliver intramuscular shots within diverting from existing priorities will not be easy. Public confidence. Optimism bias, as it is called, makes vaccination seem unnecessary to them. Concerning diseases, a lot of people tend to think that their risk is low. However, this behavior can prove a fatal in battling a pandemic like this, which is the COVID-19 pandemic. COVID-19 vaccine hesitancy is worse in EU than US. Throughout the COVID-19 pandemic, the US has been somewhat of an outlier. With merely 4% of the world's population, the US accounts for more than 20% of globally reported deaths and nearly 25% of confirmed cases. But the vaccine race in the US is proving to be a formidable competitor. Having administered 30% of the world's vaccine doses, UK has a better vaccination rate of those in the US. In the 65 and above age group, 59% have received at least one dose, and 69% of those have of over 75 have gotten one dose. But getting shots in the arms of European Union residents have proven to be much trickier. The US is vaccinating at a faster pace than any member of the EU and 3 times the EU average. The US and UK brought tens of millions of doses of several vaccine candidates prior to their emergency authorization. On the other hand, the EU took a much more risk-averse wait-and-see approach, which meant that when the European Medicines Agency granted emergency use authorization, there was little or no supply available at the launch. Why are states obtaining for global tenders? About a dozen have opted for floating global tenders to procure COVID-19 vaccines. Most of these face vaccine shortages and have halted or slowed down vaccination in the age group of 18 to 44. It is then averred in the application in order to inoculate the entire population of the country. And with those two manufacturers in the market, Serum Industry of India and Bharat Biotech, whose combined production capacity is 65 million a month, the production needs to be increased. A dismissive attitude towards the second COVID-19 outbreak that has raged uncontrolled, and a mistaken belief that indigenously made shots would be equal to the task of inoculating a billion adults have left the nation scrambling. Efforts are underway to procure supplies from Pfizer, Moderna, and Johnson & Johnson. This disparity is particularly extreme in India, which is home to 18% of the global population and the epicenter of one of the most deadly outbreaks. India equity funds have suffered their biggest outflow in more than a year in the week ending April 21. According to EPFR global data, while the rupee has slumped 3.5% in the past month, messages are rolling out from the authorities saying that a delay in getting a second dose of the vaccine will not impact their immunity against COVID-19 that develop after the first dose. COVID-19 survivors are being told to wait longer to get their first dose. Their natural immunity is expected to keep them safe for about 6 months at least. Now, I would ask Pushali to take over. Thank you.
Thank you, Pragya. Now, second session will be taken over by me. Now, as Pragya said, states are asking to global for exporting vaccines. Why? Because of lack of vaccines in India. After gifting and selling tens of millions of COVID-19 vaccine doses abroad, India suddenly finds itself short of shots as new infections surge in the world's second most populous country. India breached about 2 lakh of daily infections and is trying to inoculate more of its population using domestically produced shots. Facing cases and overflowing hospitals after lockdown restrictions were eased, it also abruptly changed the rules to allow it to fast-track vaccine imports, having earlier rebuffed foreign drug makers like Pfizer. The Serum Institute of India, the world's biggest vaccine manufacturer, had vowed to deliver at least 2 billion of COVID-19 shots to low and middle income countries, with nearly half of that by the end of 2021. But it has also come under pressure to meet the needs of other governments, including countries Britain, Canada, and Saudi Arabia. The Indian so the Indians are asking the Indian firms, however, reportedly continue to work as per the direction of central government in supply vaccines. High demand accentuated by the rising tide of the second COVID-19 wave made the availability of vaccines actually inadequate. Production of vaccines did not increase in proportion to rising demand in the backdrop of a surge in COVID-19 cases. There was not enough infrastructural preparation for ramping up the production. Now, states are floating global tenders for procuring vaccines, stating that the lack of limited availability and accessibility of medicines for treatment of COVID-19 violates the constitutional right to health and life guaranteed under Article 21. It is thus prayed that a vaccine distribution program is developed by the center which ensure vaccines are available to all free of charge. Now, which vaccines can state buy? State can only procure vaccines approved by the drugs regulator, the Drugs Controller General of India. They, in our India, only three COVID-19 vaccines have been approved by the DCGI: Covishield, Covaxin, and Sputnik. Of these, the Covishield maker Serum Institute of India is the largest vaccine producer and is based in India. Covaxin is an Indian vaccine being manufactured by Bharat Biotech, an Indian company. Sputnik 5 is Russian COVID-19 vaccine and its manufacturer commits to supply the doses to over 80 countries. It is already running behind the schedule. Its Indian partner, Dr. Reddy's lab, is still weeks away from supplying to Indian markets. Now, what Indian government and our population can expect from all these? The states who are putting out global tenders for vaccines are unsure when the vaccines will arrive. This appeared to be desperate move to appease public opinion, as the move indicates that the respective state governments are attempting to obtain COVID-19 vaccination from any place in the world, whether it is European country, it is USA, it is Canada, any country. Foreign companies should be allowed to manufacture vaccines in India, and the center should try to get vaccines from such country that have more doses than what they need. Because India is the world's largest vaccine production, the central government felt obligated to export COVID-19 vaccination when the second wave of the epidemic did not hit the country as severely. The vaccine supply shortage, however, is likely to end before July, when new facilities of the makers of approved vaccine will start rolling out vials. The central government said that the total production was likely to go up to 13 crore vaccine doses by the July from the existing 8.5 crore a month. People may have to wait till July for smoother booking of the COVID-19 vaccination slot and inoculation of the jabs. States, meanwhile, might have to reprioritize vaccine beneficiaries with a focus on bringing vaccine wastage to zero. What we know about India's COVID-19 vaccine, their efficacy rate of vaccine. First, we will talk about Covishield. It is an international clinical trial of the Oxford AstraZeneca vaccine that showed that when people were given a half dose and then a full dose, its effectiveness hit 90%, whereas Covaxin will hit 81% of preliminary data from its phase 3 trial shows. Sputnik 5, the single dose Sputnik Light vaccine demonstrated about 79.4% of efficacy according to the data. Now, COVID-19 crisis. India pins upon more vaccine supply from the USA. Our External Affairs Minister S. J. Shankar is on his way back from the 5-day visit to the US, pinning hopes on ramping up supply of COVID-19 vaccine supply required for India's mass inoculation program. Shankar's visit to the US take place at a time when India was battling the second wave of the coronavirus pandemic, with a near collapsing healthcare system, several shortages of essential medical supplies like vaccines and other injections. India has also recorded the highest death toll since the outbreak of the pandemic. Experts say that there is a substantial scope for collaboration between India and the USA toward the healthcare sector, and particularly on vaccine supply in the current scenario. The US had said it will share an additional 20 million COVID-19 vaccine doses with other countries, in addition to 60 million AstraZeneca vaccine it has already committed. Currently, 16 million doses of AstraZeneca are still undergoing the control checks by the Food and Drug Administration, will be available soon to India. Over the last 1 month, the US has been sending life-saving supplies to India. The US government companies as well as citizens have been provided over $500 million towards COVID-19 relief supplies including injections, oxygen cylinders, and 95 masks, among others, to India. There are some PIL have been filed in some states. The first judgment is an application has been filed before Supreme Court in the suo motu matter pertaining to the COVID-19 crisis in the country, seeking directions to scale up the production of vaccines against coronavirus, as well as to ensure that the full course of vaccines are available free of charge at all government hospitals and centers. The application also seeks the quashing of the decision of the center to not procure vaccines at center level, with the further direction to procure the same and distribute them to state. The application that delineates how the decision of the center to stop procuring the vaccine centrally and set the prices itself is to the determinant of the interest of the states and ultimately the citizens of India, who have a fundamental right to access essential medicines to protect their health. Second has been filed in Gujarat government, helpless in the matter of vaccine procurement. The state government also echoed the helplessness in procuring enough stock of vaccine by submitting that though the state government has placed order for procuring in all 3 crore of vaccines, but there is no timeline has been given by the manufacturers for the delivery of the said vaccines, as there are only 7 vaccine manufacturers in the world and they are not in a position to match with the high requirement of the same. The court has said observed that there is a need to strengthen our health infrastructure in rural areas by not only making the sub-centers, primary health centers, and community centers well equipped with the machines, but also by providing enough manpower by appointing doctors and nursing staff on a permanent basis. Thank you. Now I would like to Ambika to take over the next session. Angelika.
Thank you, Pushali, for handing over me the platform. So wonderful session by both of you. And now I am Angelika Sharma, and I'll be taking up the third session, that is question answers round session.
I request every speaker to put on their camera, please.
So now I have questions for both the speakers. So you can answer my questions alternatively. So my first question is for speaker number 1. So what I want to know is that India, being the biggest manufacturer of COVID-19 vaccine, why the rate of vaccination is still low in India?
So the vaccination rate on India is low because initially when the COVID second wave was not on rise, India had distributed its vaccines to other countries too. Since the lockdown, all the factories have been closed, because of which people have been facing problems in getting the basic necessary arrangements, and that is why the vaccine production has been low.
Thank you. Now I would like to ask question to second speaker, that as there is a shortage of vaccine in India, how Indian government should deal with the situation?
Okay, now as we all know, there's a shortage of vaccine in our country, and also our country is very populated country. So we need a lot of vaccinations. Now, what our country can do? Efforts we can procure supplies from Pfizer, Moderna, and Johnson, and also we can ask other countries to help us. Like now, we all know that US is about 80 to 90% has been vaccinated, and US is exporting more vaccines. So we can take help from USA, as our external minister S. Jaishankar has also visit USA for taking help. Also, we can ask other countries to export vaccines to India. According to EPFR global data, our vaccines has been in 18% of the global population, and the epicenter of one of the most deadly outbreaks has been increased. So we can take help from other countries by putting our situation in front of them.
Thank you, Pushali. Now I would like to move to again to the first speaker. So my question for you is that India has agreed to pay vaccine to various other countries as a global tender. So whom should Indian government prioritize first? Be it the countries to whom we have to export the vaccine or to India itself?
So, according to me, I think that India should pay the money to US, as Moderna and Pfizer have been the leading companies who have come out with the efficacy rate of 95%. So I would recommend that India should buy vaccines from them. Although our foreign minister has already gone to US and started with the discussions already.
Thank you, Pragya. Now, my last question for Kushali is that in past we have seen when US has put restrictions on export of raw material for COVID-19 vaccine. If the situation arises again, then how this Indian government will tackle with the situation when we will not be having the raw material, then how COVID vaccines will be produced?
Right now, our India is currently facing a very horrible surge in coronavirus infection. And also, we all know that US is playing a very great role in providing raw material to every country. So what we can do from this is we can make our collaboration with US. We can ask them to help us. We can ask them to provide us every raw material by making any pre-peace treaty, or by uh, also our Jaishankar minister has been put a step forward in this by making collaborating with US, and US has said it will share an additional 20 million COVID-19 vaccine doses with other countries, and mainly 16 million AstraZeneca to India. So now I think that this situation will not come to us in future, and we will get through this.
So thank you so much to both the speakers for their wonderful session.
Thank you, Angelika.
So I would like to thank both the speakers for their wonderful session. Now I have some questions for you, Mr. Nitesh sir, and I request you to kindly answer those questions. So I welcome you, sir. And so my first question is that if you will get an opportunity to get yourself vaccinated, if you will get opportunity to get yourself vaccinated, then will you prefer to vaccinate or you will wait for your slot?
See, in a country like India, where we have already gone across the second wave, so the time has come that we should not see that which vaccine we have to go for. So whatever slot is available as soon as early as possible, whatever guidance has been stated by the Indian Medical Association, WHO and ICMR, we shall abide by that, and to control the effect of this disease on us and to minimize the harm, we shall effectively go for any vaccination which is available to us and get ourselves vaccinated as soon as possible.
Thank you so much, sir. Now, my second question and the last question for the session is that why till today there is no uniform policy related to the distribution of vaccine?
See, the responsibility for the vaccination policy is primarily of the central government, and it is the central government who has to see the allocation of resources which is available to them. So, as in this case of vaccination drive which has been taking place, it has to be controlled by the central government entirely. It is also a admitted fact that according to the population, the number of vaccines are not reaching to the masses. The vaccine drive somehow is not being in a manner it should have been. So there is some lack of systematic approach in administrating the distribution of vaccine to the states. So the states have themselves being left into the loop, have now themselves started to go for the global tenders. However, the global tenders are not becoming so effective because the foreign nations or the pharma companies which are set up there themselves in the other countries are not ready to deal with the state. They want to go with the country. So in this regard only, yesterday, Justice D.Y. Chandrachud sir has stated that Article 1 of Constitution of India says Union of States. So, keeping that principle in mind, the central government has to come out with a uniform policy for all the states with regard to the vaccination drive, because it is not a matter of one or two, but that of the entire nation, which is looking at the central government with the ray of hope that soon our nation would be free from this uh, pandemic, and we all would build up the herd immunity. So the moment herd immunity is built up, at least our nation is safe, and we would be able to fight the third wave if at all come with regard to the pandemic. So thanks a lot for this and assisting us. And I'm also thankful to the two of the young guns, Pragya and Poshali. May I have you on screen? Who have
Yes, sir.
Poshali, can I have you on screen?
Yes,
I
sir.
am also thankful to both of my young guns who are the interns, have taken up the courage to come up on screen and speak on this wonderful topic, which is of very much importance in the general parlance. The current
Thank you.
affairs are always a part of the legal profession. One who is in legal profession has to be updated with the current news which has been happening. If you at all see in the current situations in scenario, whatever COVID matter or a PIL which has been taken up in the courts, either maybe the High Court or the Supreme Court, in both of that courts, whatever is taken up, that has been taken up with regard to the current affairs. So it's always important for us to build ourselves more stronger on the current affairs with the law itself. So with this, I'm concluding this session. Thank you, Anjalika. Thank you, Pragya, and thank you, Poshali, for this wonderful session. Hope our viewers uh, get it and understand the concept of the vaccination policy. And we will be here for them with one more sessions. Thank you.
You, sir.
Thank you,
Thank
sir.
you, sir.